So the agenda for today, I'll start by talking about Mental Health Awareness Week, and then I'll move on to the members, talking about the members in our mental health and wellbeing team. I'll provide some information on our creating a mentally healthy city strategy, and then I'll talk through each of our current projects. So we've got our 5 Ways to Wellbeing grant, our 5 Ways to Wellbeing booklet, the Black Barbershop project, the mental health awareness training, and our mentally healthy communities grants. So this week is Mental Health Awareness Week, and the theme for this year is action. So there's different actions that you can take to implement good mental well-being. Some of those things include taking time to go for a walk, especially spending time in nature, and going for a walk in nature is even better. Planning something to look forward to, having plans at the weekend, something that you enjoy, to help, give you that boost. Also making sure to check in with a friend, maybe asking a friend for a coffee or to meet up with a friend you haven't spoken to in a while. Prioritising good sleep. So, having good sleep hygiene helps give us energy and good overall well-being, and helps to lower cortisol levels. And also doing some exercise, whether that's walking, running, going to the gym, doing something that moves our body and helps boost like the positive hormones. So to begin with, just to get everyone involved, I think it would be good if everyone wrote one thing in the chat that you're going to plan to do this week for your mental health. I think for me, I'm going to try and go for a walk every day this week, depending if the weather's good, just trying to get outside, taking that time for, even if it's just 10 minutes, to get away from the screen for a bit. So I'll just give a couple minutes for everyone to sort of write something in the chat that they plan to do this week. Get my 10,000 steps in, that's really good. I would like to do that, but 10,000 steps is a lot, I don't know. But yeah, that's a really good one. Doing some gardening when it's not raining. Yeah, definitely. Gym class. Continue with my daily journaling. Yes, that's a really good one. Walking the dog, walk in nature, go swimming, read the book I've been meaning to. That's a really good one. I think I might do that. I haven't been reading books enough. That's a really good one. Walking in a bluebell wood. Yes. Go to a social event and see friends. Taking my new running shoes out for a run. Yeah. Walking, spend some time with family this weekend. Yoga class, go to the woods. These are all really good. Go for a walk in the park, a walk in the canal, social event over after work. Eat, beach, sleep, repeat. That's a good one. I don't know when I'll get a chance to go to a beach, but that's a good one. Returning back to the gym. Yeah. I haven't been to the gym probably in a week. I should probably do that as well. But these are all really good things that we can all do to, take actions for good mental wellbeing. So thank you for all commenting in the chat. So in line with this year's theme of action, this lunch and learn session will discuss the actions that the public health mental wellbeing team have taken so far to implement our creating a mentally healthy city strategy, and I'll discuss our current projects that we've implemented so far. But before that, I'll just talk through the members of our team. So we have Jo, who's our service lead, who oversees the mental health and suicide prevention streams, and also works on shaping mentally healthy council approaches and works across different council directorates and the VCFSE panel. We have our public health senior officers, so that's Shanae, who leads on the mental health and mental health action plans, and also leads on some of our priority action areas, and leads on the data mapping for mental health. We have Hadra, who's our suicide prevention lead, and works on all of the things related to suicide prevention, such as the post-vention support, suicide prevention data, specific projects, monitoring and surveillance, and incident response. We have our public health officers, so Priscilla contributes to the mental health work, co-leads on the Family Priority Action Group, and leads on the mental health awareness training. We have Priyanka, who also contributes to the mental health work, co-leads on the Places and Communities Action Group, and also supports with the data mapping and mentally healthy council work as well. I'm the support officer within the team, so I also facilitate and organise our priority action groups. I also co-lead the Families Priority Action Group with Priscilla, and I also support with some of the suicide prevention work with Hadra. And then we have OP, who is the Public Health Graduate Officer and works in our team and also leads on the 5 Ways to Wellbeing booklet project and some of the mentally healthy community grants as well. So that was sort of a summary of our team members. And I'll just start by sort of providing some background on our Creating a Mentally Healthy City strategy. So it's a wellbeing strategy that focuses on sort of the wider determinants of mental health and wellbeing, and it focuses on prevention. So it takes a prevention model rather than a non-clinical one. It's a 10-year strategy that will have a review halfway. It also has 2 strands, so it has one specific for mental health and wellbeing and one specific to suicide prevention. It's a co-produced strategy, and it also has a live framework for action. And from our strategy, we have our priority areas. So for the mental health and wellbeing strand, we have mentally healthy people, families, communities and places. So those are our 4 main areas that we focus on. And we also have our priority areas for suicide prevention. So that's improving data and evidence, providing support for people who self-harm, providing tailored, targeted support to priority groups. So that's groups that are more likely to be at risk of suicide. So like men, for example. Also increasing training and skills, providing effective crisis support, reducing access to means and methods of suicide, providing effective bereavement support, and also making suicide everyone's business. And we developed these actions from our Creating a Mentally Healthy City consultation and engagement report. We did a mental health needs assessment. We have our strategy literature review. We also did a Birmingham diagnosis deep dive, and we held stakeholder engagement workshops to get feedback, and we did all of that to help develop these actions. And so for each of our priority areas, the 4 priority areas, so people, places, families and communities, we've been holding fortnightly meetings with partners to discuss each of our actions and to break them down using the 5 Ws and 1 H method. So what, who, when, where, why and how we plan to implement each of our actions. And this slide kind of shows where we are so far. So we've developed our strategy using sort of evidence collection and co-production. We've been carrying out our priority action group meetings using the 5 Ws and 1 H to break down each of the actions. We've carried out red teaming sessions to stress test the actions, and we've done that so far for people and communities. We're still currently working on our families and community and our families and places PAG groups, and we'll use that to develop our live framework for action. And currently we're in the process of setting up our steering and delivery group. to help ensure effective delivery and implementation of our plans. So that's a summary of our strategy so far. So I'll move on to discussing each of our projects. So the first one is our 5 Ways to Wellbeing grant. So the 5 Ways to Wellbeing was developed by the New Economics Foundation, based on research into mental health and wellbeing, and they designed it to be practical, evidence-based, simple actions that everyone can incorporate into their daily lives to enhance psychological health, cope with stress, and increase life satisfaction. So using the 5 Ways to Wellbeing framework, we commissioned community organisations to deliver 1-year-long wellbeing interventions for one of our 4 at-risk communities, which we identified in our mental health and needs assessment. So those communities include neurodiverse communities, young people not in employment, education or training, long-term unemployed individuals, and carers and caregivers. And if you're not familiar with the 5 Ways to Wellbeing framework, it includes connecting, being active, learning something new, giving back, and taking notice. So one of the first grants is the Feeding Trust. So the Feeding Trust is a charity who teach and advocate for practical food skills for SEND children and their families to help with their development and growth. So their project targets neurodiverse children and their families, as well as carers and caregivers. So the Feeding Trust are working with 4 schools in Birmingham and are providing resources to help neurodiverse children and their parents with their eating habits. And as part of their project, they're arranging coffee mornings at the schools with parents, as well as online advice and guidance videos to support parents. And they're using the 5 Ways to Wellbeing to help parents and carers to connect with each other, to build new relationships and to support one another during the coffee mornings, and to help them learn new skills that they can use to support their children's eating and their children's development. We also have Pitch to Progress. So Pitch to Progress are a community organisation based in East Birmingham who support and empower young people by promoting wellbeing through workshops, youth clubs, mentoring and sports activities. So their project targets long-term unemployed individuals and NEET young people. So as part of their project, they're delivering weekly engagement sessions with young adults, including sports, creative media and group sessions, to help build connections and to help them learn and develop new skills that they can apply to future employment. And the impact that they've had so far is they've had 25 participants engage in AQA qualifications. They've had 12 participants achieve food hygiene qualifications. 5 of them have secured work experience and 3 have stepped into paid roles as a result of participating in this project. So that shows so far the impact they've had at supporting these young people to get into employment and to gain new skills and to develop. We also got Communicate to You. They are a social enterprise based in Birmingham, and they aim to improve the communication in health and social care sectors through training, research and innovation, whilst also working in collaboration with people with learning disabilities and those who have alternative communication needs. So their target community is neurodivergent young people and adults, including those with complex learning or communication needs. And there's also working with interns to support skill building opportunities in Birmingham. And their project involves fortnightly inclusive board game sessions, most hosted at Coptrick's Church, with some sessions at Birmingham Newman University. to encourage cross-community engagement and to reduce stigma. And this is quite an innovative project where the sessions use accessible cooperative games and themed activities, and it's also peer-led by the participants and the occupational therapists from Communicate to You. And these sessions help to promote confidence and social connection and personal development in a sensory-friendly environment. And we also have Sahili. So they're a charity who work with communities across Birmingham to increase their participation in sport and physical activity to help improve their physical and mental well-being. So their target group is neurodiverse individuals, long-term employed people and unpaid carers who live in ethnically diverse and disadvantaged communities across Birmingham. And so their project Thrive Together is a community-led programme offering 12-week blocks of accessible physical activity tailored to the needs of these groups. So that includes weekly power-assisted fitness, chair-based and gentle exercises, community walks, dance and cycling sessions, and also peer support and holistic employability and wellbeing support. And this project ultimately aims to help build connections, build confidence, and build self-esteem of the participants involved. So that was all of the 5 Ways to Wellbeing grants, and now we have our 5 Ways to Wellbeing booklet. So the 5 Ways to Wellbeing booklet acknowledges that the 5 Ways to Wellbeing are, a really researched and well-known framework, but feedback has shown that it can oftentimes feel abstract and doesn't always reflect people's everyday experiences or reflect the needs of communities or the barriers that they face. So this project specifically aims to make the 5 Ways to Wellbeing framework inclusive, culturally relevant and grounded in the real life experiences of people in Birmingham. So that includes, acknowledging the needs of global majority communities, LGBTQ plus communities, and also neurodiverse communities as well. So to deliver this, we've commissioned Health Exchange to undertake community engagement sessions to gather insights into how people practice the 5 ways in their daily life, what supports their well-being in their communities, and what makes it harder to engage. And so far, we've carried out one of the engagement sessions, and we have another one scheduled for the 20th of May. And the insights that we gather will directly shape a Birmingham-specific 5 Ways to Wellbeing booklet that will use real examples and lived experience and help to make the wellbeing approaches genuinely resonating with Birmingham communities. So now we have the Black Barbershop project. So Beyond the Fade is a project led by Melanin Moods in collaboration with Chaplaincy, and the project recognises the important role that barbershops play within the Black community, especially for Black men who may only open up and have conversations about their mental health and well-being to their barber. And so through a series of facilitated group sessions and workshops and conversations, Beyond the Fade aims to break down stigma around mental health and provide access to culturally relevant resources and empowers barbers and their clients with tools for emotional well-being. I've just got a video here. I think I'll probably play the first few minutes. It is like a 20-minute long video, and we'll send the slides out afterwards. So if you want to watch the whole thing in your own time, you can, but I'll just start off with the first few minutes. Yeah, so I'll just stop that there. But we will send this out afterwards. So if you want to watch the full video, you can do. But that just sort of summarises the project that they're delivering so far. Um, um, so yeah, I'll just move on to the mental health awareness training. So our mental health awareness training is a co-designed half-day mental health and wellbeing training program that is led by Young People's Education Community, and it's for various faith and community leaders in Birmingham. It's delivered both online and in person, and it's tailored to the needs of multi-faith communities. So the project started this year, and it aims to achieve an increase in faith leaders' knowledge, confidence, and ability to support mental health and well-being of their community members, enabling them to identify and respond to individuals' needs, signpost to appropriate services, and to also help reduce stigma and strengthen culturally appropriate, resilient support networks across Birmingham's diverse communities. And we also have our mentally healthy community grants. So this project stems from our Deep Engagement Partner programme, which works with 17 community and faith-based organisations to tackle health inequalities within Birmingham's communities. So in the first year of the programme, our Black, Caribbean, Muslim, sexual orientation, sight loss, and trans and non-binary deep engagement partners carried out focus groups to explore the impact and experiences of mental health and wellbeing within their communities. And from these focus groups, we offered grants to smaller community organisations with an annual turnover of £500,000 to deliver a mental wellbeing intervention for one of the 5 communities of identity. And we specifically targeted smaller community organisations to help build capacity, empower grassroots organisations, and to ensure a broader reach across diverse populations within Birmingham. So we have Aspiring Young Minds, which is a community interest company dedicated to empowering young people through sport, mentoring, and community action. Their target community is young people from ethnically diverse communities living in high deprivation areas within Birmingham and who face an increased risk of experiencing poor mental wellbeing, exclusion, and being involved in youth violence. So by embedding mental health support within a trusted sports and leadership setting, the programme engages young people who are less likely to access traditional services and also support improved wellbeing and safer behaviours. So their project uses culturally competent wellbeing education sessions, which involve understanding emotions, managing anger, dealing with pressure at school and at home, building confidence, building healthy friendships, and also developing good communication skills. They also use sport and movement to manage emotional regulation within young people. And it also offers an opportunity for young people to recognise and handle their emotions within real time during the sport activities. And they also do leadership circles and violence prevention skills. So working with young people to practice their problem solving, conflict de-escalation, and also setting boundaries and making positive choices under pressure. We have Building Communities, CIC, who support Muslim women in the Alum Rock area who experience isolation due to limited English speaking skills, low confidence, and cultural differences. So their project has engaged, their project offers weekly drama and poetry wellbeing sessions for a group of 20 Muslim women in the Alum Rock area, and this aims to help build their confidence, improve their connections, express themselves, help to reduce loneliness, and also strengthen their mental health and well-being through creative arts, including poetry, storytelling, reading, and drama. and their project has engaged a wider range of women, especially regarding their age range. So they've had women within their 20s and also women in their 60s engaging in these sessions. So the project has helped to create intergenerational connections and support amongst the women who are involved. We have EduGive, who are delivering a 12-month creative wellbeing project aimed at young Muslims aged between 11 and 18. And the project uses creative expression to act as a safe space for young people to explore their emotions, help to reduce mental health stigma, and build mental resilience. They do this through their culturally competent group sessions, where young people take part in creating their own sort of creative outputs, such as photographs, videos, podcasts, social media campaigns, all whilst group wellbeing conversations take place. They also have their youth-led anti-stigma campaign, where they use their digital content creations to help reduce stigma around mental health within Muslim communities. And they also incorporate their faith-aware wellbeing tools. So the project in itself isn't religious in its delivery, but they implement wellbeing language and concepts that are familiar to Muslim young people to help keep them engaged and to also increase uptake and trust and emotional openness amongst Muslim youth. And we also have Geo de Vivre. I think I've said that right. I'm not sure. But they are delivering a 15-week nature-based community-centred mental health and wellbeing project, specifically for Black Caribbean communities. So Black Caribbean adults aged 50 plus, and also young Black Caribbean people who are at a disadvantage, so are either unemployed, neat, or socially isolated, or have learning difficulties. So this project helps to strengthen emotional well-being, reduces isolation, and builds resilience, and improves access to mental health support for Black Caribbean communities, and aims to reach between 120 and 200 beneficiaries, and particularly focuses on engaging these communities within local nature hubs located in Handsworth. And then we also have Melanin Moods, who are delivering their Soul Food project, which is a monthly cooking programme which combines Caribbean food and mental health, as each session will focus on a new dish and a new mental health topic that they will discuss, such as stress, depression, anxiety, and practical coping strategies. And again, this is quite an innovative project which combines familiar dishes with gentle conversations about mental health. And the project creates a safe and welcoming environment for Black Caribbean communities by supporting them to reconnect with their heritage, help build confidence, and also develop new friendships with others, whilst also talking about mental health and providing mental health support at the same time. We have SENAID, who provides support for children and young people with special educational needs, and their project Safe Spaces, Stronger Minds provides support specifically to Muslim women and children and young people with SEND through anti-stigma community activities, parent support groups, and cultural guidance that can also be shared with health professionals. And they also provide support through wellbeing circles for Muslim mothers and female carers, specifically of children with SEND. And these are delivered within trusted local venues to help engagement, such as schools and mosques and community hubs within Aston and in Small Heath. And we also have the Trans Tea Room. So the Trans Tea Room is a trans-led community cafe and clothing project in the centre of Birmingham, and they provide a safe space for gender diverse, non-binary and trans individuals. And as part of their project, they're delivering monthly wellbeing drop-in sessions for trans and non-binary people. And within these sessions, they offer signposting, wellbeing support, health advice, and also direct interventions when necessary, as well as a range of support, including mental health safety plans and additional support, including housing support, support with disability and benefit funds, and also healthcare support that is specific to trans people. So I feel like I did a lot of talking there. So that was just a summary of all of our projects. So now is time for any questions. I think I'll stop recording now just in case anyone wanted to take their mic off, just to ask any questions.